presented and other presenters. Basically, just the conversations about advocacy. What is it that we can do, especially coming from a county? What role in leadership does leadership play when it comes to mental health advocacy? I think when you look at advocacy, we leave it out to the civil society. For us in mental health, you look at groups with people with lived experience. But for me, it's more perspective. When the county leadership takes it up, either by having actions directly, supporting the civil society, the families, the people with lived experience indirectly, and also influencing the other policy maker. For me, it's at the county health management team. How do I influence the other policy makers at my level to be able to see a shift in the mental health services? So we see in advocacy, in mental health, advocacy plays a role in giving dignity to the people with lived experience. So I just want to see how mental health advocacy can be able to bring up strategies and interventions that are going to help in supporting, promoting, and preventing mental health services. So what are some of the learning objectives or the questions we're asking ourselves? How do we find quality, promotive, and preventive mental health services? We are looking at how can we effectively collaborate with leaders from executive and legislative arms at the county. And I think those who come from the county, you know, if you're working at the county level in the health services, that is the executive. We have the legislative, which is the county assembly, which is very key because they're the people who give us the budget to generate interest and secure a buy-in. We all know that in health or even as a country, health is not well funded. What about mental health? Which is, I mean, I know the likes of Professor Madai has been in this game for long. But for us, you're saying, can you imagine you're saying mental health is a new thing, even getting a budget. So we really need that buy-in. Then how can we advocacy at leadership level to positively influence these changes and ensure that we have quality mental health services? So what we did is Nairobi County, since mental health was hived off from the NCD, which was it was under NCD. Um, this presentation is all about the inclusive and systemic stakeholder approach. The department has been established. How do you make sure that there is advocacy? You can't come and just work alone. So it was about establishing a framework for engagement, stakeholder engagement. Who are the other small partners in the mental health space within Nairobi that we can engage? Then we mapped all the partners that were providing a service. Number one, there were very who are directly doing mental health work, but we have other stakeholders, like for example in HIV, which has a very big component in mental health. We have reproductive health, and we all know like SRH is well funded, family planning. So it's just mapping up these stakeholders and also the other CSOs that are they were doing something in the mental health space. So we're able to map all our stakeholders. Then we were able to identify what is the priority areas, either in service delivery, in the people with lived experience, what do they feel like, the young people, we have the youth-friendly spaces, but how do they want it to be served? In result, what is it that they really need so that we work together? Then the other thing is that we did establish specialized services. As we know, Nairobi has a very big population. We really need to establish these services so that they are more accessible in the process of wanting to achieve quality mental health service. Then we created strategies to promote mental health well-being, knowing that Nairobi we serve a population of about 5 million people, 52 or more percent of those are living in informal settlements. Then you're all talking about the social determinants of mental health. They have very high risk of having mental ill health. So we really had to come up with strategies. And then also we had to come up with intervention more into promoting well-being and preventing mental health. Then all these was able to lead into the journey of getting resources toward mental health and also ensuring that we're delivering quality. And we all know when you talk about quality services, we're talking about affordability, accessibility, personal client-centered, and all that. So what were the results of this process? One of it is expansion of mental health service. Before we started this, we only had two facilities in Nairobi that were offering mental health services. One was Bagadi with one psychiatrist, and one in Pangemi, and this is because it had a family organization that was supporting the services. But out of this engagement, we were able to establish 27 clinics within Nairobi. So when it comes to about the quality, the accessibility is there. You don't have to go to Bagadi. I remember as a young clinician, I worked in a health center, and before I got into the mental health space, and when I saw a client with an abnormal behavior, whether it's a Monday or a Friday, I would write abnormal behavior, refer to Bagadi for psychiatric review. So we really need to make this, we really need to change that. Then we had expert movement, and I think we're the only county doing this, where we know about affordability and access to specialized mental health service. We had the presenters talking about mental health gap. One of the gaps or one of the challenges or barriers is access to specialized care. A psychiatrist from Mama Lucy or Pagani, which is a level 5, goes to a health facility level 3 and level 2, sees patients there. What does that mean? Number one, at level 2, level 3, they are not paying for the services. The other thing is that it means that this person at Bokuru is able to access specialists, which they would not have. Number 3, it normalizes the mental health conversation that daktari mkubwa wa akili anaonekana Mbagathi, hospitali kubwa. There's that kind of, so they are able to see where they're seen for their diarrhea. It is the same space where they are seen by a psychiatrist. Then we were able to have a child-friendly space where this one caters for children between 0 to 17 years, where they are honest for their mental health. We have a psychiatrist, clinical psychologist seated and doing this. Then we have a maternal mental health at it's sad to see one of the doctors who used to run the clinic who has moved, Dr. Mashuo, but we still continue our stronghold being Pumwani, being the biggest facility. We were able to introduce and establish a mental health unit where we offer maternal mental health services and across all the other service or all the other facilities that we deliver. Then we're able to do community mental health by training community health promoters to do screening at the community level, whole mental health conversation. The other result for human resources for health, as I said, we only had one psychiatrist in the whole county. We were able to get 4 psychiatrists. We were able to move to 4 psychiatrists. That number has shifted to currently 2. But in this current financial year, in the next few months, we're getting additional 6 psychiatrists, 10 psychologists, all because of advocacy. How did we do this? During the process of doing the CIDP, people who are familiar with the government planning process, I had, through the support of the other CSOs and partners, we sat down, identified our priorities, put them together, and they went in all the 17 sub-counties when the public participation was happening, and we were able to present our demand. And through that kind of advocacy, we were able to get employment of the new specialists. Then we had staff rationalization, and this is to the counties who are seated here. Employment is not easy. But we had people like me being a clinical officer specialized in psychology. We have psychiatric nurses working normal duties. So what did we do? Through advocacy, we were able to shift them from coming from normal duties of patient to come and do mental health work. So from having 0, we were able to have 15 of them who are running this clinic. The other one is that the other result was financing. We didn't have budget when we started, but we moved from 0 to 5 billion. Now currently with the new budgeting, we have gone down, but at least with the government, what we call County Revenue Fund, we're getting budgets from MTEM, Medium Term Expenditure Framework, and also we have funding from partners, and that is where we're able to do our activity. The other one is data collection. We also pride ourselves through advocacy partnership. We have county-specific indicators. We are the only county that has really moved on to have its own specific indicators. We have specialized clinic. We cannot be reporting mental disorders as it is in the HIS. So we have county-specific indicators, we have online reporting, and we have a data visualization dashboard. This is through the support through advocacy. We had a partner who came and we were able to develop this. The other thing is in leadership and government, we have an annual work plan. If you work in a county, you know what that one means. So we do program-based budgeting. And then we have leadership structure through advocacy. We're able to have I lead at the county, and in all the sub-counties, we have a sub-county mental health focal person. And then we have a technical working group that is made of county and also partners from different levels. Then we have referral and linkage. Again, through partnership advocacy, we are the only county that has a very specific referral. We no longer clinicians do refer to Mbagathi for psychiatric review. I'll just demonstrate how it looks like. It has where the clinic is, what kind of a clinic, is it a counseling, which day and time is there. Then community strategy, our health promoters are able to do screening and they're able to. So this is just a projection of how our dashboard looks. We're able to see per sub-county which sub-counties are reporting. As you can see, Mama Lucy is on its own, the hospital, but you can see like Westland has very high numbers because it's well supported by a partner and you have about 4 clinics that are running. Again, on the other end, we have indicators I've talked about. You are able to see that we have our indicators are derived from MH.IT. So we are able to see what our leading in. As I conclude, this is how our referral directory looks like. So it has the sub-county, it has the facility, the kind of services, if this is psychiatric who is sitting in that facility, the time and the day. So we have this in all our patients. So if a clinician wants to refer, they know where they want to refer. Then this is just a demonstration of our child friendly where we have partners who have come in and supported. We offer play therapy when they are waiting for to be seen for either therapy or they have Ken color, they have meal. I mean, it's a space. It's a safe space for the children as they come for their therapy. And this is all because of advocacy, partners believing and having us identify the areas together. So as I conclude, we want to say that leadership buying at the county level is critical for us to have open and streamlined mental health advocacy. And then we want to say that open and transparent platforms promote effective collaboration and partner engagement. What we have done as a county is have a very open door policy. Partners come in, what is it you're doing? Whenever we are doing our annual work plan, we sit together with we will say this is our priorities as Nairobi. What is it as a partner you have funding? Is it being taken care of? Then we plan together. Then advocating for positive mental health outcome in service provision, budgetary allocation, structures and policy direction, improve overall. All of these will improve the overall being of the population. So the people who are seated here from the counties, let's not just wait for the CSO to come advocate. Let's create a space where we are able to give direction, we're able to welcome them, and we all plan together. And with that, I want to say thank you.